On today's episode of the NASM-CPT Podcast with me, Rick Richey, I explore which muscles of the neck might be strained if you've got a strained muscle in the neck. So we review joint actions of several neck muscles, the most commonly strained neck muscles when it comes to strains, and we look at how the joint actions reflect the pain. And then we look at how simple supports like soft tissue approximation and self-administered muscle energy techniques may help your clients. And you don't even have to put your hands on them. It's all within your scope of practice. You're just teaching them how to do it. Make sure you like, follow, subscribe, and leave a 5-star review. Now, here's the episode. Pain in the neck. Which muscle is it?
You're listening to the NASM-CPT Podcast with Rick Richey, winner of the Sharecare Emmy Award for Social Storytelling and the official podcast of the National Academy of Sports Medicine.
Hey, y'all, and welcome to the NASM-CPT Podcast. My name is Rick Richey, and today I got a special episode because it's about me and what I'm going through. I woke up and strained a muscle in my neck, and it hurts. And listen, it's not good to be a personal trainer with a strained muscle in the neck, but also there becomes a problem is that, now I don't want to help my clients by giving them the dumbbells and the weights or whatever. But sometimes you get those bougie clients and they don't like it when you don't bring them their weights. And what a great excuse just to be like, sorry, I can't help you. Just kidding. I make everybody get their weights. And sometimes I'm very, very nice. It just depends on my mood. But listen, I got to figure out what muscle is strained. As a trainer, I want to know. As a massage therapist, I want to know. And as an anatomy enthusiast, I want to know. So we got to look at the most common options here. And so you've got muscles that can hurt. We generally see things like the upper traps and the levator scapula. So I immediately go to those first and I try to figure out, is that the one? So let's look at these proximal and distal insertions just to see if it's even in the right place. Then we got to look at the joint actions and then see if me doing those joint actions facilitate pain. Well, this will also be contingent on how bad of a strain it is. What happened? Okay, I know, because my producer asked me this. What'd you do? I woke up. No, that's the end of the story. I woke up. I didn't wake up with a strained neck. As I was sitting up, my neck started to strain, and I got to lay back down real quick, and I turned my head kind of laterally flexed to the side to make the strain, to make that cramping stop. And it stopped. And then I straightened my head back up and then it immediately cramped again. So I went back into that stretch and held it for a little bit longer just to get it to stop. But at that point, the damage was done. The neck is ailing me, but I'll be all right. But I got to know, what is it? And I think this is important. Think about, I guess you could go through and just poke it and prod it. And if you were a massage therapist, you'd be like, is this where it hurts? And you could just say, yes, that's it. You found it, right? Your finger's on it. It doesn't mean that the therapists know which muscle it is. And it takes zero skill to actually poke around and find out what hurts you. So what's the skill that's coming in here? Well, the skill that you want is to identify what the joint actions are of that muscle. And then you can do things like a pin and stretch, but you got to pin and stretch it the right way. You want to do stripping on the muscle, so following the line of the muscle. Well, how do you do that if you don't know where the muscle is and what the muscle line is? So this is going to give you a better idea as a personal trainer. Now, when we get to the end of this, I'm going to give you some things that you can do, not as a therapist, as a personal trainer, that you can do that might help them, and you don't even have to put your hands on them. And I'm not talking about just, just give the clients their weights. Like, you don't have to, you're not doing that. You are giving them techniques that can help to minimize some of the pain that they may be having, or at least give them some range of motion without even stretching the neck. So here's what I did. I got to find out what's going on in my neck. So the first one I go to is the upper traps. It's a big muscle and it's very commonly strained. So What happens, this muscle is at the origin base of the skull, so that proximal attachment base of the skull, external occipital protuberance, that big bony notch on the base of the back of the skull. And then it goes down into the posterior aspect, the lateral third of the clavicle. So it goes into the shoulder blade. And so it runs from the base of the head, the neck, down into the shoulder blades. Now, yeah, it's kind of there. The muscle that's bothering me is kind of it's in the neck area. Upper traps might be it. If I elevate, though, when I shrug, if I keep my head neutral and I shrug, I don't feel it anymore. And we know that the upper traps shrug or elevate the scapula. Well, they also do this extension of the neck, and they do contralateral, which means opposite side rotation, and they can also laterally flex the neck to the same side. Well, those all kind of make sense, but if I rotate towards the side that hurts, I feel it a little more than when I rotate it away. But it just kind of depends because of how tight my muscle is. I'm not sure which one. Now, here's what the general rule is. It depends on how much pain is there, because sometimes if a muscle is stretched or if you activate a muscle, it hurts so bad that it's just as painful lengthening as it is shortening. But if I shorten towards that side, the strained muscle is activating, that tends to hurt a little bit more. So I feel it on my left side, and when I laterally flex to the left, then it bothers me more than when I laterally flex to the right. I still feel it when I laterally flex to the right, but it bothers me more towards that side. So I know that it is a muscle that does lateral flexion. It bothers me in extension. It bothers me in flexion. So I got to figure out which one it is. It bothers more in extension than it does in flexion. But now we got to look at the rotation. So I looked at the upper trap, and the other thing it does, so shrugging it doesn't bother me, so it's probably not my upper trap. Upper traps do upward rotation. As long as I don't move my neck and I go into upward rotation of my scapula, also doesn't bother me. So I'm going to take upper traps, throw it out. This is the process that you go through to try to identify which muscle is doing what muscle is involved here. So then I go to the next most common muscle, the levator scapula. And the levator scapula originates, or one of its proximal attachments is going to be on the posterior tubercle of the transverse process of cervical spine, vertebrae 1 through 4. Well, 1, 2, 3, 4. I feel like I'm in the 1 through 4 process because it's a little bit higher up on my neck, maybe not that high, 3 or 4, 3. And so that could be it. The levator scapula goes into the medial the medial superior border of the scapula, and it does this. It elevates the scapula, nothing. It downwardly rotates the scapula. So if I raise my arm up and then I pull down against a little bit of resistance, it doesn't bother me doing that as long as I keep my neck still. So I can go ahead and just take levator scapula, probably throw it out. It also does ipsilateral rotation. So now I got to say, okay, well, does contralateral rotation bother me as much as ipsilateral? Nope. So my same side rotation tends to bother me more than the opposite side rotation, but they both hurt. So it's hard to tell. But one thing I know for sure, if it's a scapular muscle, it works at the scapula. I do an exercise at my scapula. It doesn't bother me. Take that muscle, throw it out. It's probably not the one strained. All right, this episode of the NASM-CPT Podcast is brought to you by NASM-1, the membership for trainers and coaches. Members enjoy unlimited access to hundreds of career resources, get the Edge app to schedule and program clients, enjoy half off all certifications and specializations, access to free CEUs, and more. All of this for just $35 a month. Go to nasm.org/membership to learn more about NASM-1. All right, next muscle on the list, scalenes. Scalenes, I'm thinking, well, okay, if I don't move my scapula, it's probably not a scapular muscle. Immediately I went, so maybe it's my scalenes. And here's why. Scalenes do not attach to the scapula. So I got to try to identify, is it anterior scalenes, medial scalenes, posterior scalenes? First things first, anterior scalenes, I'm going to throw them out. I don't think it's anterior scalenes because it's on the anterior side of the neck, and I'm not bothered on the anterior side. Medial scalenes kind of go from that first rib, same thing as the anterior first rib, but they go into the anterior tubercles of the transverse process, the front of the neck for the anterior. Medial go onto the transverse processes of C2 through 7. Doesn't bother me all the way down that low. But now the scalenes posterior, that one could be something here. Scalenes posterior, lateral surface of the second rib, and that goes up into C5 through C7. Now that's just a little bit lower than I feel this muscle. So I'm going to look at that and be like, I'm not really sure if that's the one. Now, let's do this. I'm going to go posterior scalenes. It can flex the neck and it can rotate the neck to the same side. Well, that same side rotation bothers me. Again, they both bother me. Which one doesn't bother me most? Well, that one. So is it posterior scalenes could be what I'm looking at, but I'm going to continue to look. And now I'm going to go to maybe some less common ones that we think about, but tend to be commonly bothered and strained muscles. So I'm going to go with the splenius capitis. Splenius capitis, it's the lower half of the ligamentum nuchae, which runs along the spinous processes of the C7 to T3 and C4 and C6. And where does it go into? Well, it goes into the mastoid process and the occipital bone. So what it does is it extends the head and cervical spine. Unilaterally, it does lateral flexion to the same side and same side rotation. Okay. All right. Well, that's potential. That's a potential one that it could be. But I feel like it's up higher than C4 through C6. And it's definitely not C7 to T3. It's not that low. So I'm going to look for one more muscle here. And I've looked at my splenius cervicis. And that one is, it starts at T3 and T6, and it runs up into the posterior tubercles of the transverse processes of C1, C2, and C3. Ooh. All right. I feel like it now C1, C2, C3, that's up pretty high. Skip one. I get to like C3, I'm like, man, the C3 might be the spot. And it's tricky because some of those muscles transfer. They kind of, C3 and C4 is where they differentiate. It laterally flexes, still hurts to laterally flex, rotates the head and neck to the same side, ipsilateral, and when it acts unilaterally. All right, so I'm going to say that it might be my splenius cervicis. That might not be. It might be my posterior scalenes. Well, what does that mean for me? Well, what do I do about it? One is I'm going to talk to you for a moment about what you can do as a personal trainer without actually putting your hands on somebody, because putting your hands on people by the way, I'm pretty well educated in fitness and in massage therapy, and I still don't like stretching people's necks. So I'm going to say, don't put your hands on people's heads and necks and stretch them unless you are licensed to do so, and unless you feel very, very, very comfortable doing that. Because for the most part, I don't actually like stretching muscles in the neck. And I certainly don't like stretching strained muscles. So we're taking strained muscles, take it off the table. We're going to look at two other things. Excuse me. We're going to look at muscle energy technique, self-administered muscle energy technique, and something called soft tissue approximation. Now, the soft tissue approximation is the easiest one, and it is by far the most boring one for your client. And what does that mean? That means the joint actions that the muscle does, which is the one that is bothering you, and we're identifying it. We're going to say it's splenius cervicis or the posterior scalenes, and they have very similar joint actions. So I think either of these work. I want to passively laterally flex, which means I am not going to actively side bend my neck. I might lean over to a side and just let my neck fall that way. It even hurts when it falls that way, so I know something's up. And then we're going to allow it to rotate. So if it does ipsilateral rotation, then I'm going to let it side bend, and I'm going to rotate and let my head just hang there, not actively. I'm very passively in that position. A lot of times better to do lying down on a pillow and just lay there. And the research says stay there for about 3 minutes. And what it does is that muscle that's short, tight, overactive, strained, potentially strained, it's just you're passively in that position. So you're not really doing anything. You're just having them go into a position and do nothing for 3 minutes. And then when it's time to get up, slowly get out of that position and see if it feels any better, because your muscles are working really hard, even while strained, to protect your neck. And once you strain them neurologically, they're very active. So if I can put them in a shortened position passively, then I can generally get those muscles to calm down, not by stretching them to get them to calm down, but by passively shortening them. And then there's another technique that you can do, and it is a muscle energy technique, a self-administered muscle energy technique. Now, my neck hurts right around here. So we're saying that's splenius cervicis or posterior scalene. And what I'm going to do is, right, it hurts to side bend. And I did this with a musician who came into town a few years ago. And one of my trainers was like, he worked with that trainer. He said, I have a concert tonight. I got to go on stage tonight. Do you have anybody that can help me with my neck? And so she sent him to me, and I worked on his neck, and I did some muscle energy techniques, and I showed him how to do it himself before he went on stage. And he was so incredibly grateful. And so I'm going to teach you how to do that so that you can teach your clients a little bit. Here's the greatest thing. It takes so little energy. That's why it's called muscle energy technique and not muscle push really hard and as hard as you can technique. It's not called that. All you're going to do is that position that it hurts. So it hurts for me to side bend to my left side. So I'm going to take my left hand and I'm very, very gently going to press it against my head. I'm very gently pressing it against my head. Now, what's happening when I press it against my head? The muscle that is bothering me is actually activating. But when I let go of it, the muscle is very happy and it's relaxing. And now I can side bend much further. And if I hold that position and I just stay in my side bend position, I give a little muscle energy technique. It is the lightest of pushing. I'm telling you, if there was a grape between my hand and my head as I push against it right now, then I might not even pop the grape. I might. But it's that kind of tension. Maybe, maybe not. Depends on how squishy or how firm your grapes are. Don't make that a euphemism. It's not intended to be. And then I'm going to relax, take my hand up, and then I can side bend a little bit more. And you can see now I already have much more range of motion. Doesn't mean I don't feel it. It just doesn't hurt. It's not stopping me. It's not locking me down. And I'm able to get more range of motion. Same thing in my rotation. So if it's starting to bother me one side towards the other, then I might say, okay, I'm going to contralaterally rotate to my right if that's bothering me. And I give a little push, no popping grapes, and then let go. And I can get much more rotation. And I can go again, give a little push. If you're watching on YouTube, this makes a whole lot more sense than if you're just listening to the podcast. I realize I'm doing these techniques and you're just listening. I'm like, and then you do this, good, and then this, and now it's better. And again, I did not unstrain my neck. I didn't do any of these techniques prior to doing the show, so I've been dealing with this just so I could come online and show you what it looks like to actually implement. these techniques and show you the range of motion that can occur by doing something like a self-administered muscle energy technique. All right. If you have no idea what I'm talking about, then go check out YouTube if you are interested in learning more about what it is that I did. And I want to say thank you so much for listening. Thanks to our producer, Eric Sorensen. And please like, subscribe, share with your fitness friends and family. Leave a 5-star review. And if you want to leave a message for me and have a topic that you want me to talk about, you can hit me up. Do so on Instagram at dr.rickrichey or email me rick.richey@nasm.org. Y'all keep inspiring people to fitness. Thanks for listening. This has been the NASM-CPT Podcast.